Respiratory alkalosis. Respiratory alkalosis is a medical condition in which increased respiration elevates the blood pH beyond the normal range 7.35–7.45 with a concurrent reduction in arterial lay. This condition is one of the four basic categories of disruption of acid-base homeostasis. Signs and symptoms. Signs and symptoms of respiratory alkalosis are as follows: palpitation, tetany, convulsion, sweating. Causes. Respiratory alkalosis may be produced as a result of the following causes. Mechanism. Diagnosis. The diagnosis of respiratory alkalosis is done by a test that measures the oxygen and carbon dioxide levels in the blood, chest X-ray, and a pulmonary function test of the individual. The Davenport diagram allows clinicians or investigators to outline blood bicarbonate concentrations and blood pH after a respiratory or metabolic acid-base disturbance. Classification. There are two types of respiratory alkalosis: chronic and acute, as a result of the 3–5 day delay in kidney compensation of the abnormality. Acute respiratory alkalosis occurs rapidly, have a high pH because the response of the kidneys is slow. Chronic respiratory alkalosis is a more long-standing condition. Here one finds the kidneys have time to decrease the bicarbonate level. pH. Alkalosis refers to the process due to which there is elevation of blood pH. Alkalemia refers to an arterial blood pH of greater than 7.45. Treatment. Respiratory alkalosis is very rarely life-threatening, though pH level should not be 7.5 or greater. The aim in treatment is to detect the underlying cause. When PaSi-Otwo is adjusted rapidly in individuals with chronic respiratory alkalosis, metabolic acidosis may occur. If the individual is on a mechanical ventilator, then preventing hyperventilation is done via monitoring ABG levels. In popular culture, in the Andromeda strain, one of the characters is exposed to contamination, but saves himself by increasing his respiratory rate to induce alkalosis.